What does Botox stand for?
Well, Botox is a brand name for a toxin called botulinum toxin, which is an anti-wrinkle treatment. So that's just one company, that Allergan company, have the name Botox, but there's lots of other companies that produce it as well.
Okay, and what is it used for?
So it's used to treat wrinkles. So basically, where someone's got a wrinkle because their muscle is constantly creasing their skin, you can relax that muscle, which allows the skin time to recover. I usually explain it with a bit of paper, which I'll show you. So if you imagine your skin's like this bit of paper, I'm someone that naturally frowns a lot, so when I drive I frown, and when I inject people I frown. Can't help but do it. It's one of my concentration things. But that constant frown action like that is going to, over time, cause a line in the skin, and that line's going to gradually get deeper to the point where it eventually becomes a wrinkle, and in some people can become a bit more of a furrow. So the aim of Botox is to treat the muscle that's actually moving the skin rather than the skin itself. And it's almost as though gates come down, so the brain's still saying to the muscle, frown, but when the Botox is there, that gate's down, the message can't pass to the muscle, so the muscle doesn't move the skin stays flat, and that resting skin then can recover and the line can soften, and in light cases where it was just a fine line, it might even disappear, but in other cases it will definitely improve.
So how deep are the lines that you would use Botox for?
How do we assess whether Botox would work or not? We do get you to make expressions to see if the lines get stronger. So I might ask you to do a really big smile if you were worried that the lines around your eyes were caused by the smile muscle. So if those lines got stronger on smiling, I would know that you're likely to get a good result with Botox. And same with people getting horizontal lines across the forehead. If when I get them to raise their eyebrows, those lines that are running horizontally get a lot stronger, I know that then by softening that muscle and by making it relax, those lines are also going to soften. So lines that don't change with movement are unlikely to be improved by Botox.
Okay, so would you need to use other treatments for those?
Yes, so sometimes we get people coming to us with lines around the upper lip, for example. Yes, you can actually do a very subtle Botox treatment, but it's not always the ideal way to resolve those because it changes the way the muscle around the mouth moves, so you might look a little bit different when you're talking and when you're trying to hold a straw. So there's a better way of treating those, which is with dermal filler, and then you're not having to alter the function of the muscle.
So what is the treatment process like for Botox?
It's very straightforward. You would basically come in for a consultation. As I said, we would make the assessment first of all to see are you going to benefit from it by getting you to do some of the facial expressions. We then use a little pencil to mark the muscles very precisely, and we inject those areas with Botox, and it takes a matter of a few minutes.
Do you see the effects straight away, or is it something that would take time?
Unfortunately, you won't see the effects straight away. You will see a gradual weakening of the muscle, so it's not moving as much over the first week. But your major stillness comes usually at the 2-week mark, and improvement in the skin, though, will continue for weeks to come. So the longer the skin's kept flat like that and not creasing, the better those lines get. So you start seeing improvement, within the first week. Optimum improvement's usually seen at about the 3-week mark, but it can still get better from that point onwards.
What would it feel like having it done? Does it hurt, or do you have any pain afterwards, or can you not feel anything at all?
Yeah, most people just describe it as a very sort of short-lived little scratch in the skin. It's a very fine needle that we use. It's one of the finest that we can find, and it's pretty painless treatment. I have it myself and I'm a bit of a wimp. So if I can cope with it, it's usually fine.
And when you touch your skin afterwards, does it feel normal, or
at the time of the injection you'll have these little red blebs, look a little bit like mosquito bites. They don't stay there for very long. They usually disappear within a matter of 20 to 30 minutes, and afterwards your skin will look like normal. I should mention, if you're very unlucky and we were to nick a little vessel on the way in with the needle, you can get teeny tiny bruises, but they do tend to be small with Botox.
So are there any sort of negative side effects that you could experience other than just some bruising?
The less common side effects is thinking about the structures that are near the area that you've treated. So it's about knowing your anatomy and being precise with your injections. But if you perhaps didn't have someone who's as an experienced injector, you might have a slightly higher risk of causing a heavy brow or even a sort of heaviness to the eyelid when you were having a frown treatment, or on the forehead you could get that happening as well. And around the eyes, some of the less common side effects are dry eye symptoms if Botox affects the tear gland. But as I say, you can minimise those by knowing your anatomy and injecting very precisely. The other thing with complications is that Botox is not permanent, it does wear off. Usually on average a treatment will last someone around the 3 to 4 month mark. So if someone was to have an unpleasant side effect, it's never going to be permanent, it's going to wear off, yes. And you're not usually waiting the duration of 3 to 4 months for it to wear off. It's usually a matter of several weeks and then you're back to normality.
So is it something that you'd have to have done every 3 to 4 months, or do the effects last?
It's a personal choice really. So if you were brand new to Botox and you thought, I want to see what it's like, you could have a one-off treatment and then never have it again, and your skin will just go back to how it was before. It's not going to have done you any detriment from having had the treatment. You're just back to square one. But if you like the result of the treatment and you want to maintain it, you will notice that all those lines that were there before are coming back again. So that's when you would then have a repeat treatment. So it's a very personal choice, but there's no hard and fast rule that once you've had it, you're going to have to continue it, because you just go back to how it was.
What does the consultation involve?
So we like to check that you've got no contraindications to being treated, so no reasons we can't treat you. And the main no-nos to Botox is pregnancy and breastfeeding. So we will ask you that question if you're female. And in terms of your general health, we just like to have a little bit of background information just so that we know that we're doing appropriate treatments for you as well. And in terms of the rest of the consultation, it's answering any questions you have about how Botox works, any worries you might have, and your expectations of it, so that we're marrying up the right treatment for what you're hoping to achieve.
And with the aftercare, obviously once I've had the Botox, is there anything that I should be doing?
Yeah, we do give very specific instructions about do's and don'ts after you've had a Botox treatment, and that's so that you get your best result to minimise the risk of any side effects. So some of the aftercare includes, for the first hour, activating the muscle that we've injected. So if we've treated your frown, for example, we'll ask you to frown on and off for the first hour, and if we've injected around your crow's feet, we will ask you to smile a lot in the first hour. It just activates the Botox, and then that will work over the next sort of fortnight for you. The other thing that's quite important is to stay upright for 2 hours and not be lying down or leaning on your head, and that just minimises risks of side effects of sort of heavy brows and some of the other things we talked about earlier. There's also a 2-day rule of heat and alcohol avoidance, and the reason for that is when you drink alcohol or you do anything that makes you hot, like exercise, you can flush your face, you send more blood up to the face, and that there's a theory behind that blood can steal the Botox from the area and you not get as good a result. So it's all about you getting the best value for your money and getting the result that you're after to follow the aftercare.